Hello everyone, I am Dr. Pramod Reddy Kandakure. I am Chief Cardiothoracic and Minimally Invasive Surgeon in Medicover Hospital, Aotic City, Madhapur. So today I am going to discuss regarding VATS and robotic surgery. VATS is a video-assisted surgery which is done on chest as well as lungs as well as heart. And the same procedures can be done with a robotic surgery also. So robotic is a newer technique which we are using it, and it is a minimally invasive. Both VATS as well as robotic is a minimally invasive technique to do surgeries for heart, lungs as well as some mass in the chest cavity. So what do you mean by VATS? VATS is a video-assisted thoracoscopic surgery. So we make a small hole and put a camera inside the chest, and then we see with the camera so what structures are there, and we do some other extra small incisions. We put it, and then we make small holes. Through that holes we pass the instrument and then do surgery. That is called VATS surgery. So it can be done for lungs as well as for the heart also it can be done. And other surgeries which we are recently started doing is endoscopic surgery, that is without cutting any incision, only the ports are there, and with that one, with the help of the instruments, we could pass the instruments and then do the surgery. The third one is a robotic surgery where we use a robot. We actually don't scrub with the patient. So there is a robot, there is a console is there. We sit on the console and do the surgery. So the movements on the console are transferred to the robotic arms, and the robotic arms will do the surgery. So these are the advances which has happened in cardiothoracic surgery recently. So what surgeries can be done with these procedures? So coming to the cardiac surgery, heart surgery, the heart surgeries, what we normally do is ASD, that is a hole in the heart, valve repair, valve replacements can be done, and some bypass surgeries like single graft surgeries can be done through this minimally invasive robotic surgery or video-assisted thoracoscopic surgery. Coming to the other surgeries like lung surgery are surgeries where we require some biopsies to be taken from the lung, or we need to resect the lung part because of some tumor is there. Those surgeries can be done through this video-assisted thoracoscopic surgery. Also, the surgeries which has mass in the mediastinum, like anterior mediastinum, middle mediastinum, posterior mediastinum. These are different parts in the chest cavity. So those mass or cyst can be removed with the help of this scope. So no bigger incision, small incision, minimal invasive incisions we can put, and then we can remove this with the help of scope. The third surgery is a pleural space. The pleural space is there, that is a chest cavity. Outside the lung and the chest cavity, there is some space is there where normally some small amount of fluid is there. So in some patients, they have pus in that fluid, in that cavity, that is called empyema. So those types of surgery we can do we can drain the fluid from the chest cavity, as well as we do a decortication. Decortication means removing the thick material from that is a cover which is formed over the lungs, that we can remove so that the lung will expand, the infection will get controlled. So these surgeries can be done. So coming to the what precautions we have to take or what tests we have to do before surgery. So we do routine examinations, whatever required for surgical profile, that we call as anesthesia fitness. So those tests are required. Then CT scan is required especially for the heart surgery. Echocardiogram is required, ECG is required, chest X-ray is required, and sometimes we do a CT scan because sometimes we have to put cannulas in the groin. So we do a CT scan to see the arteries are good to do these types of surgery. So once a thorough assessment is done, then we do this surgery. So depending upon which side we do surgery, right side or left side surgery. So if the lesion, the lung part or the chest, the more of the mass is on the right side, then we put tubes in the scope through the right side. If it is more on the left side, then we put a scope on the left side and then do surgery. Sometimes we do a uniportal VATS, that is called a small incision is there, that's a working port is there in that roughly around 5 centimeter, and then 1 or 2 extra ports we put it sometimes if required to do the same surgery. where the mass is very big or the lung is very badly adhered to the chest wall. In those cases, we do a small incision, and then we, with the help of the videoscope, we do it. Plus, where we do mitral valve surgery, we do a video assisted. We make a small incision this side. Aortic valve surgery also we can do by making a small incision this side and then putting the camera and then working through that same port, we can do these surgeries. So what are the risks of the surgery? So it is less risky compared to the normal surgery which we do from the bigger incisions from here or bigger incisions from cutting the chest wall. So these incisions can be done in small. The incisions are very small, so that we can do with less pain. Post-operatively, they will have less pain, less bleeding, and the patient will have an early recovery and less chances of infection as well. The hospital stay also will be less. So these advantages are there when we do these types of surgeries. So the risk of these surgeries are less compared to the normal surgeries which we do through thoracotomy or sternotomy. So coming to in short, what benefits we get by doing this surgery? These are the recent advances or recent techniques which has developed for the more patient comfort and early recovery of the patient. So it is less painful, less chances of bleeding, less hospital stay or short hospital stay, early recovery, minimal pain. These are the major advantages what we can offer in VATS or video assisted thoracoscopic surgery, cardiac surgery and robotic surgery. Thank you.